You don't know. And part of that is what's driving a lot of people out of this industry and into things like real estate, childcare, things that are just less stress in general.
From red alerts to staffing shortages and ambulance wait times, the ongoing EMS crisis in Alberta has many patients and paramedics feeling frustrated. And many of those burnt out paramedics are leaving the industry for good. Brian Middleton is a primary care paramedic who, through FOIP, the Freedom of Information and Protection of Privacy Act requests, is sharing data he collected as a patient advocate, not as an employee of Alberta Health Services.
We lost over 300 individual bodies from the work pool in the Calgary zone. That's not even provincially. And when the number of staff you're dealing with, that's close to 8% of people just decided to hang up their uniform and go do something else so that they could spend Christmases and birthdays with their family. They didn't have to worry about career-ending injuries.
While staffing shortages aren't a new challenge, he says the data shows paramedics were burning the candle at both ends over the holidays, with 64 vacant shifts highlighted on Christmas Day and another 53 on New Year's Eve, just in the Calgary zone, leaving only about 29 staffed resources to service all of Calgary, Kananaskis to Strathmore, and Red Deer to Fort Macleod. Middleton says this time last year, an industry record was set locally, but not in a good way.
We were doing 99% utilization sustained for weeks at a time. That means in a 12-hour shift, you have 8 individual minutes that you are not responding to an emergency, transporting a patient in a hallway, or being moved between stations for deployment coverage.
Middleton says that's 8 minutes to prioritize eating and taking a bathroom break. And with the average AHS paramedic quitting within an 8-year span, he says the compensation hasn't been incentive enough to stay.
I don't know any other jobs where you may have to go to work and encircle your hands around the torso of an infant trying to revive them, and you're only doing $3 more an hour than you were 8 years ago when you had to do it for the first time.
Despite calls for better compensation for Alberta's healthcare frontline workers, the Smith government says more money isn't going to solve the brokenness in the system and is rolling out plans for restructuring instead. In Calgary, Shilpa Downton, City News.